For patients that don't qualify for a DAIR procedure, patients that present with an infection that's been there for a longer period of time, we will consider a two-stage procedure, and that's taking the implant out, putting a temporary spacer in there, and then planning on putting an eventual hip or a knee replacement back in there. Unfortunately, our success rate doesn't allow every patient to get a new hip or a knee replacement. When we look at all periprosthetic joint infections, we see success somewhere in the ranges of about 75 to 80%. And that's a demonstration of how difficult it is to get rid of these infections. Many people end up having these infections for the rest of their lives. For some of these patients, we can also do what's called a suppression. And suppression is where we put patients on an antibiotic that they take for the rest of their lives. It slows down the growth of infection. It keeps patients oftentimes from getting sick or having clinical symptoms or running fevers and having chills. And it prevents them from getting bacteria in their bloodstream. And it allows them to keep their hip or their knee replacement much longer. Unfortunately, there are a group of patients that go on to need amputations as well. We can't control their infections, and we work with our plastic surgery department for those patients. For patients that undergo an amputation, we also include what's called targeted muscle reinnervation, and that's a procedure that prevents phantom pain. And that's a really large problem when it comes to amputations. Phantom pain can be debilitating for many patients. Our plastic surgery team here at Ohio State University does an excellent job, and many of them were even trained in the military, where this is unfortunately a common occurrence, where they'll take the sensory nerves, the nerves that are in that stump or right at the amputation site, and they'll reroute those sensory nerves and they'll put them into a motor nerve. That fools the human body and the brain into thinking that that sensory nerve hasn't been cut and it's in a continuous loop. And the brain then doesn't give the patient the phantom pain, and they don't get that debilitating problem that many of our amputees out there in the world develop when they unfortunately need this type of a procedure.